is a superior view of the two menisci. On here we have the lateral menisci, which is a more thicker, larger menisci compared to the medial menisci. This is because it's more stronger than the medial menisci. So we start with the cruciate ligaments. We've got the anterior side here with the lateral on the right and medial on the left. So we got the anterior cruciate ligament attaching to the lateral side condyle of the femur and attaches to the intercondyle eminence of the tibia on the anterior side. And this prevents the femur from rocking backwards onto the tibia. And on here on the posterior side we have the posterior cruciate ligament attaching to the medial side of the condyle in the femur and inserts into the intercondyle eminence of the tibia on the posterior side. The patellar ligament is pretty straightforward. It connects the inferior aspect of the patella to the tuberosity of the tibia, and this keeps the kneecap in place and also helps extend the knee. And so with the two collateral ligaments, we have the fibular collateral ligament on the lateral side, and it's pretty much connecting the lateral epicondyle of the femur to the fibular head, and the tibial collateral ligament connecting to the medial epicondyle of the femur. Right here in the posterior view of the knee joint, we have the two popliteal ligaments. We've got the oblique popliteal ligament and the arcuate popliteal ligament. Both these ligaments play an important role in only the posterior side of the knee as they act to stabilize the knee joint. When the knee is pulled forward or medially, the ligaments tighten and assist the posterior capsule of the knee joint.
So the knee joint is one of the most complex joints in the human body. It consists of the femur, tibia and patella regions, okay, all the bones really. Okay, together these create three functional articulations, the first of which is the femoropatellar articulation. This consists of the patella and the patellar groove. Your second and third ones are the femoral tibial articulations, which consist of the lateral and medial condyle joints. Okay, with the femoral patellar articulation, your femur articulates this region of your bone with the tibia in this region. Okay? Together this creates a plane synovial joint which allows that sliding. Your second one, your femoral tibial articulation, this consists of this region on the femur joint here. Okay? This creates a modified hinge joint that allows the actual rotation and passive rotation of your knee. So the fibrous capsule is thin and incomplete in some areas, but together with the ligaments, they create a strong base for support during movement. Okay, so anteriorly we have the quadriceps tendon that follows the attachment of the quads. So this comes down towards the patella, okay? That's your quadriceps tendon. Your patella here, okay? And then we have your patellar tendon, which links the patella down, attaching to the margin of the tibial plateau.
one at the patellofemoral joint and one at the tibiofemoral. So the patellofemoral joint is a sliding articulation that slides superiorly when the knee extends and inferiorly when the knee flexes, and is stabilised by the lateral femoral condyle. This rounded aspect of the distal end of the femur acts as a bony block to limit lateral motion during knee flexion. So that's that. There. So there. It is also stabilised by the retinacular tissue, which also is found medially and laterally stabilising the patella. So if we have the patella and the retinacular goes like that. Next is our tibiofemoral joint. It functions to transmit the body weight from the femur to the tibia. So what stabilises that joint is the cruciate ligaments, so ACL and PCL, the collateral ligaments on either side, medial and laterally. The iliotibial band also helps to support the knee to limit internal rotation of the tibia on the femur. Also the meniscus, lateral and medial add depth, thereby aiding its stability. And the joint capsule also encloses these joints to make it more stable as well.
Knee injuries are very common and they occur in people of all ages. They interfere with many things from participation in sports to simply getting up from a chair and walking. This may have a major impact on one's life. A dislocation occurs when the bones of the knee are out of place, either completely or partially. For example, the femur and tibia can be forced out of alignment and the patella can also slip out of place. The most common disease affecting the knee is osteoarthritis. This is a condition in which the natural cushioning between joints, known as cartilage, wears away.
So biomechanically, the knee joint is involved in a lot of movements, okay, in the vertical and horizontal direction. So that's jumping or walking. Here we have our patient sitting down at the moment in the flex position. As she stands up, her femur is going to slide superiorly. Okay, so we have the femur joint here. As she sits down, her femur is going to slide inferiorly. The four muscles that make up the quadriceps are your vastus medialis, okay, the intermedius, as well as your lateralis. Over the top, okay, we have our rectus femoris. The hamstring comprises of the biceps femoris. Okay, so if I'm moving lateral medial, okay, laterally we have our biceps femoris, then we have our semimembranosus, and then our semitendinosus. Okay, together these create the movements of flexion and extension during vertical and horizontal movements.
Knee joint can be easily injured during sports or work that requires twisting movements, sudden stopping and starting, changes in directions and collisions with other players. A common knee injury is an osteochondral lesion, which is also known as a cartilage tear. Common signs and symptoms of an injured knee are swelling, persistent pain, catching or locking during certain movements, and giving way unexpectedly. This X-ray shows such an injury with a lesion occurring in the anterior weight-bearing medial femoral condylar cartilage. Damage to the surface cartilage increases friction in the knee joint and decreases shock absorption. If large pieces of cartilage are floating inside the knee joint, particularly if they are attached to a bone fragment, the joint may lock. These loose bodies cause further damage to the joint surfaces and osteoarthritis, which will worsen with time. This, as a result, reduces quality of life. The aim of surgery is to smooth and roughen edges of the articular cartilage and remove loose debris. This, along with post-surgery rehabilitation and recovery, leads to an improved quality of life.